Hi again. So, having tackled fertility, I want to move on to pregnancy now. And I know that this is something that's caused an incredible amount of anxiety for women and men as well, who are supporting their partners during this time, when actually there's been a huge amount of change that's been dictated by this pandemic and has meant that pregnant women have felt very cut off from the rest of the world, and felt incredibly anxious about the lack of support that some of them have perceived from all of this, including the fact that we haven't been able to provide as many appointments as we would have liked, and also the changes to do with how many people are allowed to attend your labour, or if you're admitted antenatally and postnatally. So let's talk about this in a bit more detail. Now, the main worry when the virus first came into being was to do with not just the effect on the mother, but also on the baby. And to start off with, we only had a small number of studies from China that looked at a really small number of people affected with coronavirus who were pregnant and the outcomes in these. And our biggest concern at that time was the potential increased risk of preterm labour in women, but we didn't really understand whether this was a risk or not. And also there was the suggestion that the virus potentially could cause some intrauterine growth restriction or smaller babies. So we had to take these concerns on board, and as a result of that, every woman who has had coronavirus is followed up with a scan 2 weeks later in order to check on the growth of her baby. And we've also absolutely realised the importance of regular antenatal checks. So these may not have been deliverable face to face all of the time, in which case they've been replaced by video consultations or telephone consultations, but it's still been really important for women to have that face-to-face contact, only we've had to sometimes combine a couple of different things in an appointment. So for example, when you're coming for a scan, you might have also then had an appointment with your midwife and your consultant, who can all see you at once. And that's been really important for a few reasons. The main one has really been to try and reduce the risk of infection to yourself when you're traveling and getting to the hospital for that appointment, and also in order to try and reduce the risk of infection spreading in the waiting area within the hospital setting, but also to staff who need to take care of you as well. So that's been a major stumbling block and also turning point for us, where we've had to adapt to these different circumstances and how we operate our maternity services, which have come under strain during all of this. But nevertheless, obstetric care and labour ward care has remained an absolute top priority for the NHS. And thankfully, it's meant that we've been able to continue these services for women, despite the burden that the pandemic has placed on all of our frontline services, and essentially having to redeploy staff from certain areas in order to serve on that front line, which has sometimes meant A&E or the intensive care setting. So some of the other concerns that we've had with the virus is when it appears to potentially affect women the most. Is it the first trimester, second trimester, or third trimester? And to some extent, we still don't fully understand the effects on the first and second trimester, simply because the virus hasn't been around for long enough. And with viruses like Ebola and Zika, for example, the virus was in existence for quite a few months before we were able to truly tell the effect on mother and baby. This virus really has only been around for 5 months, so we just don't know enough yet. But from a recent study that's been conducted as part of the UK surveillance system, whereby every mother who develops coronavirus is followed up to see what the outcome is for her and her baby, we've had some really reassuring data that's literally just been published. And that data suggests that a woman who is affected by coronavirus only has a 0.5% chance of being admitted in pregnancy. That's to a hospital, which essentially means that actually a woman who's pregnant isn't at any greater risk of developing complications from coronavirus than the general population. So this is really good news, and something that we suspected from the start, although our concern was to do with the fact that women's immune systems are slightly different when they're pregnant, which means that the way they handle the virus can be different as well. hence why women who are pregnant still continue to be placed in that vulnerable risk group and must take those extra precautions when socially distancing and also minimizing their contact with anyone else, simply because we're still learning, and as we continue to learn, our guidance changes. But certainly for the time being, this evidence is very, very reassuring, and this was done on a sample of over 400 women admitted to hospital. The other really good news is that if you are admitted to hospital with coronavirus, then your chance of being admitted to intensive care is only 1 in 10. So the chance of you going into hospital in the first place for coronavirus is very low indeed. And then of you being admitted for very serious complications is even lower than that. So again, really reassuring evidence that we have so far about all of this. Another concern has been the risk of transmission from mother to baby. And whereas we initially thought that this wasn't possible because we didn't really see that placentas contain the virus, and also amniotic fluid didn't seem to contain the virus either, we have since then come to learn that actually it is possible for this virus to cross that barrier and to be transmitted from mother to baby. However, even when this is the case, the overwhelming number of babies are completely fine, and the risk of preterm labour also continues to be low. In fact, there were only very, very few babies who were born before 32 weeks of gestation, and from 32 weeks onwards, the chance of survival is much greater for babies, and also the risk of any severe complications is a lot less. So again, this is something that we can take comfort from. And also the fact that so far, as far as we can tell, breastfeeding is safe, and we very much encourage mothers who want to do this to be able to do this with their babies for a couple of reasons. One is to increase the bonding between mother and baby, and to reduce the chance of the baby developing any respiratory infections, because we know that important immune modulating substances can cross over from mother to the baby in breast milk, and that's really, really important, especially at this time as well. And also some studies which suggest that longer term children's behaviour is positively impacted by that bonding that babies have when they're held close and they're breastfeeding as well. So this is something that, again, women should take great comfort from, and also something that in the UK we are positively encouraging. Now, I realise, and all of us who are obstetricians realise, that actually in terms of the care that we're able to provide at the moment, it's severely lacking in certain areas. So for example, the fact that we can only allow one birth partner during labour, and it has to be active labour. This again is to reduce the risk of transmission of the virus, and the person who attends has to be well themselves. So if there's any chance that they may have coronavirus, they won't be allowed to attend, which is why it's so important to have a backup plan of someone else who's able to come and be there for you in case this happens. It also sadly means that if you are admitted antenatally for any other reason, or postnatally if there are any complications with your birth, your partner or anyone else won't be able to be there for you. And then when you do go home with your baby, sadly, the contact that you have with other people is also minimised because of the social distancing rules, although these have got better recently. So actually it's meant that a lot of the contact has had to be virtual. We've had to improvise a lot of things, and video calling and FaceTime has become really, really important for women who are going to scan appointments on their own in order to try and involve their partner, and also if they happen to be an inpatient before they deliver. So that's been really, really important, as has the emphasis on mental health, which of course affects pregnant women massively, and especially those who have had mental health conditions diagnosed in the past. It's really, really important that you reach out to your midwife during this time, or your doctor, and if you anticipate or see yourself getting worse or getting anxious, that you tell someone as soon as you can so that provisions can be made for you. We will absolutely not be neglecting anyone during this time, and we will do everything that we can to support you and your baby during what we know is a really anxious time for all women who are pregnant, whether it's their first pregnancy or not. So this is really, really important. The other thing that I want to emphasize is the importance of coming to hospital if you notice anything abnormal. So If you have got symptoms of coronavirus which are mild, you are advised to stay at home, and that remains true because what we don't want is to risk that infection spreading within the hospital. But if you develop any more severe complications, or your symptoms are not settling, or you develop other symptoms, so for example something that's completely unrelated, say your fetal movements reduce, it's really, really important that you contact your midwife or contact your doctor, you call your maternity team and you tell them about it. And if you're asked to come to hospital, that you do this. Please don't think that you're overburdening us or that you're coming in unnecessarily. This is a really important time to make sure that all women and their babies are kept safe. And what we don't want to see is anyone suffering in silence and hope, because this is really quite possibly the worst thing that you can do. So even if you're coming into hospital, it's just for that reassurance and you're asked and told to come to hospital, it's really important that you follow this advice and that you do that, because we are still here for you. Our services remain open. We want to see women attend if they need to attend. And most importantly of all, we want to keep all mothers and babies safe. So that's my big message to you. And for anyone who is pregnant during this time, I hope that this advice has helped. I really want you to feel supported, or as well supported as possible during this pandemic. And just know that we are here for you, that though this is a very uncertain time and our guidance may change as new evidence evolves, overwhelmingly at the moment, the evidence is very reassuring. So please try not to worry too much if you are pregnant, and if you are worried, do reach out for help, because help is available. Even if it is on the other side of the phone or through a virtual consultation, it's still very much there. So I wish you the best of luck for both yourself and your baby.